Okay. Hi, my name is Cecilia. I'm gonna be a nurse practitioner. I'm gonna be doing a video for the neuro assessment. Would that be okay for me to record a video?
Yes, sure.
Okay. So I'm gonna be asking you first of all a couple of questions. So what is your name?
Aline,
And what is your date of birth?
10/17/71.
Good. And what did you do this morning?
I went running this morning
Good. And where are you right now?
in your clinic.
Okay, and then I'm gonna ask you questions from the past. So when did you get married?
In 1992.
Good. So do you know do you remember who is the president?
Yes, Trump.
Good. So what would you do if there is an accident on the road? You see somebody lying, I don't know, like looks like it's injured.
I called 911.
Good. So I asked Aline questions about herself. She answered everything correctly. She knows where she is. So she remembers. She's oriented in person, place, time, and event. She also has good speech. She has good memory from the past and from recent memory from today. She also has good reasoning. She can judge what to do in any stressful situations. So then we're gonna be assessing for the cranial nerves. So the first cranial nerve I'm gonna be assessing is for the from the olfactory nerve. So the first number 1. And so I'm gonna ask Aline to cover her eyes, and I'm gonna let you smell something. Let me know what it is.
Flower,
Good.
perfume.
Yes, that's good. So her cranial nerve 1 is intact. So the next cranial nerve we're gonna be assessing is for the cranial nerve 2, which is the optic nerve. For that, I'm gonna be using the Snell chart, and so I'm gonna be asking her to read the last line, cover one eye, and then cover the other, and then we read, so Aline, can you cover your right eye, and then read the last line here?
L T T P H.
Okay, now the other eye. Cover the other eye and read.
L T F P H.
So I'm supposed to be 6 feet away from the patient. So if she has her eyes would be fine, then it would be 20/20. But her right eye is slightly decreased. So that's for cranial nerve 2. So the next thing I'm gonna be asking her for peripheral vision. So I'm gonna be asking her to cover one eye and then cover the other, and I'm gonna be asking her to tell me when she see 2 fingers or 1 finger or how many fingers. So I'm gonna ask you to cover the right eye and then open your eye, the other eye. Tell me how many fingers you see.
2, 4, 4, 3, 2, 1.
Okay, then with the other eye.
2, 2, 5, 5.
Perfect. So the next thing we're gonna be doing in this is the fundoscopic exam. So I have my ophthalmoscope here, and I point a light to her eyes, and I look with my right eye. So with right eye. So I look at the red reflex, the vessels, fovea, macula, cap, optic disc, and that's it. And then we go to the other eye. Look at the red reflex, the optic nerve, fovea, macula cap, and the vessels. And then we go to, so that's it for the eyes. The next thing I'm gonna be doing is the oculomotor. So for the oculomotor, so we test for 3 different nerves. Is number 3, number 4, and number 6. So number 3 is the oculomotor, the number 4 is the trochlear, and number 6 is abducent. For number 3, we do move an object to the side, and number 4 and down, we move. For number 4, we move the object down and medial, and then for number 6, we move it laterally. So we take this object. I'm gonna ask you to follow this, and then no, with just look at, just your face, keep it straight. I'm gonna ask you to move the eyes. With your eyes, follow this. So perfect. So that we evaluate 3 cranial nerves. Number 3, oculomotor. Number 4, trochlear, which is downward and medially, and then number 6, which is laterally. Then I'm gonna be evaluating for cranial nerve number 5. So it has 2 components. One is the sensitive, and the other one is the movement. For the sensitive, we ask the patient if she can feel in the forehead, the cheeks, and the jaw. So I'm gonna ask you, can you feel this? And tell me if it's dull.
Yes. 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 Yes.
And so that's for the cranial nerve number 5. We can also ask Aline to open up your jaw and move it side by side. Yes, okay. So that she's able to move her jaw very well. And so evaluate for cranial nerve number 5. For cranial nerve number 7, so there are 2 areas. So one is for the ring. So she has to wrinkle your forehead, puff your cheeks, smile. Good. So everything is good for cranial nerve number 7, which is the facial nerve. And nerve number 8 is the acoustic. So for the acoustic, I do the whisper test. So for the whisper test, I'm gonna tell Aline to say, I'm gonna tell her 3 different words or letters, and then I'm gonna ask her to repeat. I'm gonna tell you something, but it's whisper.
Flower, pen, paper.
And then on the other side, yellow, bicycle, coffee.
Yellow, bicycle, coffee.
Okay, so the acoustic nerve is intact. So, but in case the patient doesn't have good hearing, then we do another test, which is the Weber test. So we strike the fork in any surface, and we place the fork on her forehead. Can you hear on both sides?
Yes.
The same?
Yes.
Perfect. So another test we do is the Rene test. Strike again, and then we place it on the muscle bone here and behind the ear. And then tell me when you don't hear.
Stop. It stopped.
Can you
I
still
hear now.
Very good. So I'm gonna strike it on the other side and place it on the muscle bone. Tell me when you don't hear.
I don't hear. I hear.
Okay, good. So her conduction is greater than bone conduction. So her the Rene test is perfect. Is normal. So the next test we're gonna be doing is the cranial nerve number 9 and which is the hypoglossal. And I'm sorry, the number 10 is the hypoglossal, and number 9 is the glossopharyngeal, which is I'm gonna ask her to open up your mouth. Say and then we look with the light to see if there is the uvula is moving. Say perfect. And then also I'm gonna tell her to so for cranial nerve number 12, and so I'm gonna tell her to stick out your tongue, move it to the side. Okay, close your mouth. Now you're gonna do like this on your cheeks. Yeah, perfect. So that's for cranial nerve number 12. So for cranial nerve, for the glossopharyngeal, we also tell the patient to swallow. Aline, swallow for me. And then we see if there is any difficulty, if she's coughing or she cannot swallow, then something is wrong with cranial nerve number 11. For then the for 9 and 10, I'm sorry, 9 is the glossopharyngeal, 10 is the vagus nerve. For spinal accessories, which is the sternocleidomastoid muscle and the trapezius muscle, so I'm gonna tell Aline to move up your shoulders up, like when I do like this, and then press, and then move to the side, this side. Okay, good. Now this side. So she has good strength, and the sternocleidomastoid muscle and the trapezius muscle are they have good strength and they're normal. For the then we go to the evaluation of the cerebellum, which is we evaluate for gait and then for the rumbar test. So I'm gonna ask you to walk, Aline, here, from here, walk straight all the way there, and then come back. Okay, and then, yeah, that's the tandem test. Is when we tell the patient to walk one foot ahead of the other one, and then come back and do the same. So she has very good gait. Tandem walk is normal. So I'm gonna ask you to walk on heels this way and come back on your heels. Okay. So come back, and then I'm gonna ask you to walk on your toes. And okay, good. So the next test we're gonna be doing is the rumbar test. So I'm gonna ask you, Aline, to stand up for me. Close your eyes. So then we look at the patient. If the patient is kind of moving to any side, we get ready to catch the patient just in case. Some patients, they have neuro cerebellum difficulties, so then we have to be aware of that. Okay, you can sit down. So another question for we're gonna evaluate for rapid movements. So I'm gonna ask you to place your hands like this, and then move them like this. Okay, quickly. Perfect. So she has good coordination. So the other test we can do is also ask the patient to follow my finger, and with your finger touch your nose, then touch my finger, and then here, and then again touch your nose, touch your finger, and then here. Perfect. She is able to follow the movements, and she has good coordination. So the next thing we're gonna be doing is for position of the joints. So I'm gonna ask Aline to close her eyes. Close your eyes, please. I'm gonna be asking you what side I'm moving your fingers.
Up, down.
Perfect. So we look on both sides.
Up, down.
And then we look at the toes also.
Down.
Okay, and then the other side.
Down.
Okay, so we look at both sides bilaterally, evaluate for a joint position. And then we do also 2-point discrimination. So for this, I'm gonna be using 2 different pins. I'm gonna be asking Aline in both extremities up if she can feel 2 or 1. Okay, close your eyes.
2,
And then
1.
it was actually 2.
Are
But when
you-
you put it together and in the hands, sometimes you don't hear, you cannot feel, you feel only, but it's normal. So also we do it on, so close your eyes.
2, 1.
Yeah, so it's just, okay, so here, another.
2,
Perfect. So she has good 2-point discrimination. So the next thing we're gonna be doing is the so we do for upper so we do the stereognosis or the graphesthesia. So for right now I'm gonna do the stereognosis. So I'm gonna make draw something on your hand, and you tell me what I'm drawing
number 8,
with your eyes closed.
13,
Good, good. So she has good graphesthesia, and it's normal. So also we're gonna test. Also, with your eyes closed, I'm gonna ask you if you feel dull or you feel sharp on your with your.
down, down, down,
Now in the lower extremities.
sharp, sharp,
Good. So she has good discrimination of the feeling if it's sharp or dull. We also can do the vibration test, which is with the fork. We also strike the fork and we place it in the bone prominence. Okay, so I'm gonna put here and you tell me if you can. Can you feel the vibration? No?
yes,
Yes? Good. And then on another bone prominence.
yes,
And then also we do it for the toes.
yes, yes,
Perfect. So she has good sensation and vibration sense. And so the next thing we're gonna be doing is looking at the motor. So we're gonna test for the motor strength. So we're gonna be asking Aline to see if she's her strength. So the first thing we're gonna be testing is for the biceps, the triceps, and the deltoid. So for the biceps, I'm gonna ask you to put your hands like this, and then I'm gonna pull, and then you pull against me. Yeah, perfect. Both sides are equal. So for the triceps, you keep your hands like that. I'm gonna push you. Good. So she has good strength, 5 out of 5. For the deltoid muscles, you can keep like that, and then I'm gonna try to move your shoulders down. Yeah, good. She has strength, 5 out of 5. So the next, for the lower extremities, for the quadriceps muscles, so I'm gonna be asking you to lift up your knees, and then I push them down against. Yeah, good. So she has good muscle strength. For the hamstrings, I'm gonna be asking Aline to lie down, and so lift up your so for this, I'm gonna be asking Aline to push myself down. Yeah, good. And then from the other side, good. So also we evaluate the abductors, the hip for move your side to the side. No, lying down. You're gonna be moving your hip, your leg that way, laterally, and then in the middle, and then the same with the right leg, and then in the middle. So that way we evaluate for the lower extremities, for the quads, hamstrings, and the adductors and adductors. So she has equal muscle strength on upper and lower extremities. And then we do the deep tendon reflex, which is with the hammer. I'm gonna do the deep tendon reflex for the, Aline, can you sit up? Yes. So the first one I'm gonna be assessing is for the biceps. So I hold her arm and I strike and see for the reaction. The next one is the triceps. And we do on both sides. Oh, this one. Okay. And then on the triceps. And the next one would be for the knees. For the knees. For the knees, then we strike the patellar reflex. And then the other side. And then for the Achilles reflex, I'm gonna ask the patient to lie down. And then you can turn on back. Like, no, like on your back.
On my stomach.
In your stomach. So for that, I'm gonna strike the Achilles reflex right here. So we do it on both sides. And look at the reaction. Another, so for the superficial reflex, I'm gonna do with her foot. She should be lying down, but we're doing it like this. Ooh. But do you feel something?
Yes.
So
Sharp.
we strike the foot and look at the toes fanning for Babinski reflex. So that concludes all the neuro assessment. Thank you.